Hi, my name is Brooke Quesnell, and I'm a veterinary nurse with my VTS in oncology. Today, I'm going to be answering a couple of the most frequently asked questions regarding client counseling prior to an oncology consultation. Our first question is going to be, what does the oncology consultation process look like? So initially, of course, your primary veterinarian is going to refer the client to an oncologist. At that point, the actual consultation itself can be very similar to any other initial veterinary exam. We go through the entire process of vitals, history taking, discussion of comorbidities, medications the pet may already be on, as well as the pertinent information to why they have come to see the oncologist that day, whether they have already been diagnosed with a very specific cancer, or if there is a high suspicion of cancer in that pet and they have elected to forward them on to an oncology practice for further diagnostics, staging, and discussion of treatment options. What if my client has financial concerns or other concerns that they may not want to pursue chemotherapy? It is always important to let your client know that whether they have the intention of pursuing treatment or not, again, it doesn't matter if it is a financial issue. It could also be that they have, experience with a family member who went through chemotherapy and it was very hard, difficult. A lot of people do that. That is our association, right? If their pet has never gone through cancer treatment, they've never had another pet. Very, very key to let them know a couple of things. As far as financial concerns go, we, during that oncology consultation, are going to talk to them about everything. So we will go through all treatment options available, survival times, everything involved with that, and then work with the client to come to the decision of what they feel is best for their pet. There are a myriad of things that we can recommend, all the way from the very minimal of, just going with prednisone or a steroid, all the way to the extremes of those treatment options that we can do: full chemo, surgery, radiation. There are options out there regardless of what their financial status is. Another big hiccup that a lot of owners encounter, as I said, is their previous experience or already their mindset that they have about cancer treatment when they relate that to humans. So it's important to let them know that our goals with chemotherapy or radiation, any treatment in our small animal friends, is very different than in humans. The best comparison that I like to give my clients is that in a human, it's worthwhile to make them feel like death for 6 months to a year if they're going to get another 30 to 40 years out of their life because of that treatment. That same mindset does not apply to our cats and dogs. So with that, our goal is to keep them comfortable, make sure that they can continue to do their daily things. We want that dog to still be able to go for its walks, run around in the backyard, whatever its favorite activities are. And same for our cats. We don't want to have an impact on their daily lives. And so it's important to make sure that the owner knows that the goals with cancer treatment in small animals are very different than in people. And the goal is quality of life. And our last question, what if my client is worried about being judged for the decision that they make for their pet? This is also something that I see very commonly when we do have a client come in for their first consultation. As I mentioned in the last question, some people may have financial concerns. They may just not want to do full-blown chemotherapy. And after they've talked with the doctor about all of the treatment options, it can be a little overwhelming. And some people do seem to feel that they will be judged if they don't pursue those more expensive, more effective treatment options. So definitely need to make sure that we are conveying to the client before they come for their consultation that our goal in the oncology practice is to provide them, again, with all of the information that we can about their pet, treatment options, outcomes, prognosis, while still supporting them in what they feel is best. So whether they elect to do nothing or just a simple, let's do some steroids and make them feel a little more comfortable, all the way to I want to do everything under the sun that is available, we are happy to support them in any decision that they make. So make sure that those owners are really aware that our goal in the oncology practice is to make sure they have all the information that they need, and we're going to support them in whatever walk they elect to go down. And those are some of the most frequently asked questions regarding client counseling prior to an oncology consult. So thank you for listening.